Hi viewers, this is midwife reality show.ke. I'm Mary.
My name is Evelyn.
Today we are here to learn more and to have fun.
Yeah.
So kindly subscribe to our channel.
Share, comments.
Yeah, and that is how we grow.
Yeah, don't forget to leave a suggestion. Thanks for the people who have already subscribed, and for the new ones, karibuni sana.
Okay, now today we have I don't know what I call it, a long topic.
It's a short one. Just a short one.
Is this a short topic?
Mm-hmm.
From the time you conceive, when you go to the clinic,
what to expect every visit.
Every visit in every clinic that you are, antenatal clinic that you attend.
Yes.
The basic tests that shall be done.
Yeah.
And the expectation.
Yeah.
From us, the care provider.
Yeah.
And also, what do you expect to receive from us? This is what we are about to tell you today.
Yeah.
Yeah.
So that you are aware of what to expect in every visit.
And so that if not done, you can always ask.
Yeah, for it. It's true. It's good to ask.
Ask why it's not done.
Yeah.
So that you also be in the page.
Exactly.
We always say it's always good to... I have a role as a care provider.
You have a role as a client.
You have a role as a client.
Yeah.
You must know what is expected of you.
Exactly.
And we also should deliver what is expected of us.
Because it's your right.
It is your right.
Yes.
So work hand in hand with your care provider.
Yeah.
Work during this journey of pregnancy.
Exactly.
So today, let's start from the time you realize you're pregnant.
Yeah.
Previously, we discussed how most of us come to realize how we are pregnant. So either you get that morning sickness, you miss your menses.
Yeah.
Or
you just suspect yourself.
Or you just suspect and you do it's confirmed that you're positive.
Yeah.
Now, when you confirm that you are for sure you are pregnant, the next move you should attend
a clinic or an antenatal clinic. Yeah.
Within the first, preferably if you're able to be caught within the first 10 weeks.
Exactly. Before the first 10 weeks, you should attend.
Yeah.
That is if you have realized before 10 weeks. Remember, some of people realize when it's already passed.
Sure.
Yeah.
So if you realize before 10 weeks are over, it's good you go see your doctor, see your midwife.
Exactly.
Yeah, and when you start your antenatal clinic, there are a few things that are expected of you.
Yeah.
When you go to the hospital or to the clinic, you're supposed to give a full detailed report about yourself.
Actually, before you get to the history, remember the choice of a hospital also matters, because there's a cost implication that will come in here. Yeah. Not every antenatal clinics are free. Most of them, and most of the private sector clinics will require you to pay. Require you to pay some amount. So it is also good to be prepared financially.
For sure, yes.
Yeah, it's also good to be prepared financially so that you don't get frustrated. So it's your first visit, you've already chosen a hospital, you've gone there, you had already carried money, or you've decided to just go to a place where there are no charges.
True.
So you're already there the first visit. What do you expect? We go back to the history now.
Yeah, so now you've already made your choice.
Yeah.
You're going to hospital B.
Yeah.
And now in this hospital B, you'll meet with the first care provider.
Yeah.
And once you meet with the care provider, you'll be required to give a full detailed report about yourself. About yourself. That is what we call history taking. Yeah. The care provider will have so many questions. Yeah. And that is why you hear people talk about
Maswali ya clinic.
Maswali ya clinic. Yeah, because they want to know how have you been before the pregnancy set in. any chronic illness that you have suffered from, please don't try to hide.
It is good to be open.
It's good to be open.
It is not because of the provider's benefit. It is for the benefit of you and the baby you're carrying.
For sure.
Yeah.
Some will ask you very detailed, like any chronic illness.
And also like very personal questions.
Very personal questions.
Yes.
Like they go to an extent even of asking how many sexual partners you have.
Exactly.
Yeah. In this clinic, they will also do several blood works.
Yeah.
One is to confirm HIV.
Exactly.
Your status.
Yeah.
You may be required to come with your spouse.
That is my next question. I wanted to ask, do you think it's good for somebody to go with a partner?
Yeah, the first clinic is okay.
It's always
good to
that
go
is
together.
If available,
if he's there.
Yeah.
So HIV will be one of the tests that will be done.
Yes.
The next one is severus.
Yeah.
Most of the kids who are born blind, you'll find
the sexually transmitted diseases. Yeah.
So the most common that normally is recommended by the WHO is you must do a severus test. The other one is to check the blood level.
Yeah, the full blood count.
Yeah,
the full blood count. They'll tend to draw blood from you and check several things like blood level, the
that
platelets.
Means, do you have enough blood for yourself and your baby?
Exactly.
Do you have any other infection apart from now the 2 sexually transmitted diseases?
Yeah.
Do you have any other
infection? They'll also do a malaria test.
Yeah.
They'll do a malaria
test. Especially if you're in a pandemic area that like Kisumu, that is a must.
Yeah.
And they will also check on.
They'll do a blood sugar. And most importantly, they'll also do a urine test.
Why do you think we do a blood sugar?
A blood sugar is, it's done because it's good to get, remember these tests we are doing them as a baseline. It's your first visit, you've just come to the facility, we've never met, you don't have your file when you're pregnant. So we want you to have a baseline so that in case you develop an issue during this journey of pregnancy, we are able to tell that there was no problem, it has just developed. Or if in case there's something you didn't tell us about yourself, we are able to pick
on time. Okay. We'll also do a full physical examination.
Yes.
Full physical examination, that is where the doctor checks on your eye, your tongue. Yeah. Do you have any goiter? Do you have any lumps on your breast?
Yeah.
Listens to your chest with a stethoscope.
And if any surgery
previously,
they'll be known by scars on the abdomen or
anywhere else. Yeah. If you've realized when it's a bit late, they will be able to see at what weeks are we by touching or by palpation, what we call medical palpation. Yeah. Then they'll give you health education on nutrition. We'll give you health education on nutrition, on hygiene.
Yeah. And that is where they also give you, before you go home on that day, depending on which facility you are able to buy supplements or they will give them for you.
Yeah. Like you'll find 90%, almost, let me say 100% of our facilities, we normally give mothers blood supplements.
Yes.
That is blood boosters.
Yeah.
We give calcium supplements.
Yeah.
And omega.
Omega-3, yeah.
Yeah, and more so if you're not prepared, we top up with folic. But there are those mothers who've been looking for pregnancy.
Yeah.
We normally prepare ourselves by starting
the folic acid earlier before conception.
But if you have not started, now this is the right time for you to be commenced on it.
Yeah.
Evelyn, you mentioned something about urine. Why would you be interested with someone's urine?
Urine, for urine, remember, when your kidneys have a problem, maybe they're spilling out protein. Then when we get protein in urine, or when we get some things that in urine that should not be there, for example, there's blood in urine, there's protein in urine, the doctor is able to interpret exactly why there's that element in urine and is able to treat you. The urine can also help the doctor know or detect a urinary infection.
Actually, even we'll also be able to see, is there any sugar or glucose in
in
urine?
Exactly.
Then in the same as you do the physical examination, we also do the vital observations. What are the vital observations?
The blood pressure. Blood pressure of the mother. And as we said earlier, blood pressure is a key thing in pregnancy. So if there's a problem with the blood pressure, the doctor is able to pick and escalate as required. We also check on the heart rate and the temperature. If they are normal, then we are good to go. If there is an abnormality about them, then the doctor is able to attend to each.
Sure.
Yeah.
That is very good.
Yeah.
Like now you've gone to the clinic. We have our working platform.
Yeah.
All our working baseline.
Yeah.
We know your BP. You started with a normal BP.
We know your weight, we know your height.
We know your height, we know,
exactly.
Because also weight is a key thing that we really monitor when you're pregnant.
Yes.
Like you would take for granted, today I'm 82.
Yeah.
Then by the end of my pregnancy journey, I'm expected to gain
more than 10
more
kgs.
More than 11.
Yeah.
We
actually 12.
11 to 16
yeah.
kgs.
Yeah.
In the whole journey.
Yeah.
So you can see how weight is such a factor that you may ignore.
Yeah.
So every clinic you must have your weight checked. Then you may also you will also be started on those supplements.
Yeah.
So that now you'll be doing, if you started your clinic at 10 weeks, your clinic is, if everything, the bottom line is everything is normal, you'll be attending your clinic after every month.
Yeah.
You may also be required to have a scan.
Yeah.
In that
the first visit, depending on what gestation. Okay, how many weeks you have come to the hospital?
Just to have an expected day of delivery, and just also confirm that the baby is forming well.
Yeah, because there are those
mothers confirming
the
pregnancy.
Yeah, those mothers who come to the hospital, they tell you, I can't remember my last menstruation period. So it is not very easy to calculate without a scan.
Yeah,
it is good to do a scan.
So it helps us to get EDD.
Yeah.
EDD, that is the expected date of delivery.
To confirm pregnancy.
To confirm pregnancy.
Yeah.
So that is why we do that first scan with the first touch of the clinic, the first day you go to the clinic.
And for mothers who have conceived with some family planning method, especially the IUD.
Also now you confirm the IUD with the scan. Is it still there or not there?
Yeah.
Yeah, sometimes some will have come out, some will just be hanging somewhere. Misplaced.
Yeah.
And then the midwife or the doctor will advise you more on it.
Depending on the scan findings.
Yeah. So the first scan, you've seen how important it is. So then we move now from there. If everything is within normal, we'll be coming to clinic.
After every 1 month.
After every 1 month.
Yeah.
Like now the second trimester, now by the time, if you first went at 10 weeks,
yes,
after a month we'll be in second trimester.
We'll be in the second trimester. Very true.
Right?
Yeah. So now will I be required to do a scan that time?
Yes, no.
Yes, no. What do you mean yes, no?
Yes, no means we may decide just in second trimester we'll be required to have one scan.
Yeah.
At least at 16 weeks to 20 weeks gestation, to confirm anomalies and growth of the baby.
Yeah.
Are we forming well? Because in second trimester we talk of the baby having the external structures?
Yes.
Hands, are they forming?
Yeah.
Are we having any defects?
Is the baby well formed?
Is the baby actually the formation of the baby?
Yeah.
Yeah.
Are there any abnormalities that we need to detect at this point before the pregnancy proceeds? Yeah.
Then every month we'll be doing your weight.
Yeah.
Your BP.
Yeah.
Your temperature and basically your vital signs.
Yeah.
BP, temperature, and
so the first visit was the one which had so many things because it was the one we were being introduced to the facility. So the second one will be lighter. Yeah,
it will be lighter.
Yeah.
So we'll do your weight, BP, temperature.
Yeah.
And urine. If we have an urine, urine is every
visit.
Every visit.
Yeah.
And this one will do urine every visit regardless of the gestation.
Regardless of the gestation. Very true.
Because what are we trying to track? We are tracking either
any blood.
Any blood.
Yeah.
Any blood in urine.
Yeah.
Any infection. Because when you're pregnant, you're so prone to getting
a lot of infections.
A lot of UTIs, urinary tract infections.
Yeah.
You're also prone to getting high BPs that we can track through the urine by getting you have protein.
Yeah, maybe Mary, we can tell them, why are you checking for this UTI? Why do you think UTI is a very dangerous thing in pregnancy?
UTI causes most of the abortion.
Thank you. Yeah.
It's our major cause of. So these are things that we can prevent. If I find we have urinary tract infection and I treat on time, then I avoid you going into early
labor. It's a major cause of premature labors.
Yes.
Yeah.
So again, I may find there is glucose. Glucose would mean I investigate mother more
for that.
For diabetes.
Yeah.
Because there are those diabetes and hypertension that come about with pregnancy.
Yeah.
Then I'm able to capture them on time.
Exactly.
The other thing is weight gain. In second trimester, I expect not so rapid weight gain, but at least a change.
There should be a change.
There should be a change.
A positive change in the weight.
At least you should gain a bit.
Yeah, even if it's half a kg.
Even if it's half a
yeah, even grams.
Even grams I would
should show some positive.
Again, I don't expect you to gain too much in that. If you're gaining too much, that means we are not able to remove all the waters from our body as required.
There might be a problem.
There might be a problem. So that will trigger us do more
to investigate more.
Yeah. So now when we get to, we've done our BP, we've done our temperature, we've done our weight, we've done our urinalysis.
Our baby is growing well as
per the scan. No anomalies.
Yeah.
So now we move on monthly again.
Yeah.
But if there is any problem, like we found there were proteins in the urine, there were sugars, then your clinic will be done like 2 weekly, or even closer.
Yeah.
Even you can be given clinic that is weekly.
Exactly.
Depending with the problem that you have found out.
Yeah.
Then from there we move to after our second trimester.
Before we get to the second trimester, Mary, if a person was not maybe given a tetanus vaccine, they are supposed to be given like twice or once, depending on whether the person had already gotten in the previous pregnancy. These are during the first trimester. They're supposed to be given a jab. So you'll be directed by your doctor or by your midwife. Every visit you'll be directed when to get what. Yes. Remember, that is where you normally have the clinic card, the clinic record, the antenatal record to show when. And even you, if you are able to read, you can read what am I supposed to expect in my next visit.
Yeah, like in the second trimester, if for the last 5 years you've not had any tetanus injection, you'll have your first dose. So that in the third trimester you get your second dose.
Exactly.
But if you, within the last 5 years, you've had a dose, then you'll only need in that trimester where you get a booster dose.
Exactly.
Regardless whether you're going to deliver in the hospital or at home. Yeah, it's always good to prevent than to cure.
Remember, tetanus is not curable. It's a very dangerous one. So it is good to get it as per the card. Or as it's required or as it's recommended. Yeah. So Mary, you had told us that you will go monthly until we get to how many weeks?
Until we get to around 36.
Not unless we have a problem.
Yes.
If we have a problem in between, please don't hesitate to go to the hospital. Don't hesitate to contact your doctor. And it's also good to have your doctor's contacts in case of any emergency.
And also, it's always good also to liaise with the hospital where you're attending. Like know how they operate so that when you have a problem,
you know where to go.
So then now we move to the third trimester.
We are now at that 30 weeks,
We are at that from 28 to 40.
Exactly.
We are at that trimester. But we'll focus more on from now
36. We will focus from 36.
This is where the weight gain comes. Like we expect you to gain 200 grams per week.
The baby
gains 200 per week.
Between 200 and 250 per week. So that in a month they can gain between like 500 to 600 grams in a month. So they tend to add weight so much during that time.
So once we hit to 36, 37 there, we'll do a repeat scan. Remember, this is our third scan. Now this scan, what does it confirm?
It confirms the position of the baby.
Our baby, is the baby lying this way? This way? All these are positions.
So that it can tell us or it can guide us in what method of delivery we're anticipating.
And now from there, mother can be prepared. If the baby is seated, if the baby is transferred, so that you can prepare the mother, the size of the baby.
Exactly. So that we
the
know
size,
that,
in relation to the pelvic rim.
Pelvis,
and now another thing we do a booster dose of
tetanus vaccine.
And then from there, we also do check blood level. Now remember, we are just now getting ready
for the delivery.
We are getting ready for the delivery. So if it's a CS or a normal delivery, we need a mother who is. Remember, we've been equipping you with supplements.
We keep telling you about education, about nutrition, exercise.
So now we just want to confirm, now that you've been taking the supplements, have we gained enough blood that can pull us through during the process of the delivery? Viewers, we also forgot to mention a very key thing in first visit. A mother should always know her blood group.
Exactly. That is something we really forgot to mention.
Your blood group. So if let's say it was skipped because maybe it is not your first baby. Now if you can't remember, we should have it done. Because if your rhesus negative, you need
an injection.
You need an injection at 28
weeks.
And another one after
delivery before 72 hours.
If the baby is
depending on your baby's blood group.
If the baby is rhesus positive and you are rhesus negative. So you need something we call anti-D. All these clinics we are checking on, we are doing physical examination, we are listening to the baby, we are looking at the baby position, weight gain. We've done this scan, it has confirmed that baby is lying properly, and now we are expecting labor. We are going to expect labor. We cancel you on
labor
and delivery. You are also cancelled on the unexpected outcome. This is usually a very bad class, like where some things can go wrong.
It's good to be open-minded.
It's good to be open-minded.
Yeah.
You are aiming at a normal delivery. Things don't work out.
Yeah, as planned.
As planned.
Yeah.
You are also taught on all these classes. All these clinics you've been taught on danger signs of pregnancy.
Yeah.
So also now you are taken through that process of even what if we are expecting you to have a normal labor.
Yeah.
What would help us let the baby down?
Yeah, like we did in our previous videos.
Yes.
Like we even did a tour when we have taken you through what to expect in a visit. Now the baby is term. You're ready for delivery. As we said in our previous video, you need to know when to get admitted as guided by your doctor. Yeah, and then things flow and the baby comes.
Yeah, and if you're for a CS delivery, you're also cancelled on the same.
Exactly.
Like if we don't have enough blood or your mother at risk, you are also cancelled. Do you need to bring donors before?
Yeah.
Do you need, what exactly is required?
Yeah, because guys, a CS and a normal delivery or a vaginal delivery, they're just modes of delivery. Modes of delivery. Here, we are looking at a good mother and a good
outcome at the end of the day.
So if you're told that, you had planned for a normal delivery and now because of some circumstances, we cannot do the normal delivery, it is also good to be open-minded because at the end of the day, we want a crying baby. That's what we
a crying
say.
Baby and a live mother.
And a live mother. Okay?
Yeah. So it's good that you visit the antenatal clinic.
Yeah.
The soonest possible once you realize that you're pregnant. Always see your midwife or your gynae. That will help you. And that can prevent us having many incidences or other problems that are fatal.
Know what to expect during every visit so that also we avoid frustrations.
The last minute.
Litigation issues. Yeah, you see?
So like if you go to the clinic and you find like your legs are swelling and the doctor didn't comment or the midwife didn't comment, kindly ask, and my legs are swelling, is everything okay? Then probably he'll give you an overview of what has been happening. So always be your first doctor. Ask and you shall be answered. So with that we end our video there. And let's meet tomorrow. Bye.
Kindly subscribe,
share, comment
and leave a suggestion. Bye guys.